Welcome to our Obstetric Bedside Ultrasound curriculum. Let's review a collection of online educational videos about assessing the postpartum uterus with bedside ultrasound. Our learning objective is to differentiate between a normal and abnormal postpartum endometrial stripe using bedside ultrasound. After delivery, a transabdominal ultrasound probe can be used to visualize the postpartum uterus. After a normal delivery without bleeding complications, you can expect the uterus to look like this. The uterus is outlined in yellow, and the arrow is pointing to the endometrial stripe, which will vary in appearance after delivery due to physiologic variations in retained decidua. The stripe can appear thin, thickened, irregular, or symmetric in shape. There is no cutoff that defines a normal endometrial stripe in the immediately postpartum uterus. This is an example of a normal uterus prior to delivery of the placenta captured on both bedside ultrasound and MRI. Look how the endometrial stripe is apparent quickly as the placenta is delivering, as noted by the arrows on the MRI images. If the placenta does not fully expel, or if portions of the placenta remain inside the uterus after delivery, the uterus will not be able to contract effectively and an endometrial stripe will not be clearly visible on bedside ultrasound. Retained products or accumulation of blood clots within the uterus can result in uterine atony and abnormally heavy postpartum bleeding. Bedside ultrasound can be used to help assess patients experience postpartum uterine bleeding. Be systematic in your approach to evaluating the postpartum uterus with bedside ultrasound. Start at the level of the pubic symphysis with your probe in a transverse position and sweep superiorly to view the bladder, noting whether it appears empty or distended. From there, sweep up until you reach the fundus of the uterus. When at the fundus, rotate your probe 90 degrees so you see a sagittal view of the uterus. As you slide down the uterus, use small motions to sweep left and right to get serial sagittal views of the uterus as seen in this video, all the way from the fundus to the lower uterine segment, taking note of the endometrial stripe and presence or absence of retained products or blood clots. Let's look at more examples. On the left, you see a normal postpartum endometrial stripe. It is somewhat thickened and irregular in appearance. On the right, you see an example of an abnormal appearing postpartum uterus with evidence of a blood clot or retained portion of placenta, which can look like a discrete mass or like a collection of fluid on bedside ultrasound. Depending on the clinical scenario, bedside ultrasound with these findings may require intervention with either medication or procedures, and further evaluation will be warranted. Let's look at another example. In this video, you see a series of sagittal views of a postpartum uterus with an abnormal endometrial stripe. As we scan from the fundus towards the lower uterine segment by sliding the ultrasound probe, a large clot is apparent in the lower uterine segment and vagina. Near the fundus, you can see an abnormal appearing endometrial stripe which is outlined in yellow. Though there are no formal cutoffs for a normal postpartum endometrial stripe, applying a caliper can provide helpful context if you suspect retained products or accumulating blood clot. Near the lower uterine segment and extending into the vagina, there appears to be a large blood clot which is outlined in green. There are many ways bedside ultrasound can aid in evaluating patients after delivery. Common examples include confirming presence or absence of retained products or large blood clots, placement of a postplacental IUD, evaluation for free fluid in the abdomen, which is called a FAST scan, or, like in this video example, to perform an ultrasound-guided bimanual exam in the setting of retained placenta. In this video, you can see the movement of the provider's hand performing the bimanual, followed by expulsion of the retained portion of the placenta on ultrasound. After the retained products are removed, a normal-appearing endometrial stripe is apparent. For the full-length videos featured today and more awesome ultrasound content, check out our references.